A common cause of tinnitus is inner ear hair cell damage. Tiny delicate hairs in your inner ear move in relation to the pressure of sound waves. This triggers cells to release an electrical signal through a nerve from your ear to your brain, which is your auditory nerve. Your brain interprets these signals as sound. If the hairs inside your inner ear are bent or broken, they can leak random electrical impulses to your brain, causing tinnitus. More causes of tinnitus include other ear problems, chronic health conditions, and injuries or conditions that affect the nerves in your ear, or the hearing center in your brain. A number of health conditions can cause or worsen tinnitus. In many cases, an exact cause is never found. In many people, tinnitus is caused by one of these conditions. 1. Age-related hearing loss, meaning that for many people, hearing worsens with age, usually starting around age 60. Hearing loss can cause tinnitus. The medical term for this type of hearing loss is presbycusis. 2. Exposure to loud noise, such as those from heavy equipment, chainsaws, and firearms, are common sources of noise-related hearing loss. Portable music devices, such as MP3 players or iPods, can also cause noise-related hearing loss if played loudly for long periods. Tinnitus caused by short-term exposure, such as attending a loud concert, usually goes away. However, both short and long-term exposure to loud sound can cause permanent damage. 3. Earwax blockage. The earwax protects your ear canal by trapping dirt and slowing the growth of bacteria. When too much earwax accumulates, it becomes too hard to wash away naturally, causing hearing loss or irritation of the eardrum, which can lead to tinnitus. 4. Ear bone changes. As you age, stiffening of the bones in your middle ear, known as otosclerosis, may affect your hearing and cause tinnitus. This condition, caused by abnormal bone growth, tends to run in families. Other causes of tinnitus are less common, including A. Meniere's disease. Tinnitus can be an early indication of Meniere's disease, an inner ear disorder that may be caused by abnormal inner ear fluid pressure. B. TMJ disorders. Problems with the temporomandibular joint, the joint on each side of your head in front of your ears, where your lower jawbone meets your skull, can cause tinnitus. C. Head injuries or neck injuries can affect the inner ear, hearing nerves, or brain function linked to hearing. Such injuries generally cause tinnitus in mainly one ear. D. Acoustic neuroma. This non-cancerous benign tumor develops on the cranial nerve that runs from your brain to your inner ear and controls balance and hearing, also called vestibular schwannoma. This condition generally causes tinnitus in only one ear. E. Eustachian tube dysfunction. In this condition, the tube in your ear connecting to the middle ear to your upper throat remains expanded all the time, which can make your ear feel full. Loss of a significant amount of weight, pregnancy, and radiation therapy can sometimes cause this type of dysfunction. F. Muscle spasms in the inner ear. Muscles in the inner ear can tense up, which can result in tinnitus, hearing loss, and the feeling of fullness in the ear. This sometimes happens for no explainable reason, but can also be caused by neurologic diseases, including multiple sclerosis. Blood vessel disorders linked to tinnitus. In rare cases, tinnitus is caused by blood vessel disorder. This type of tinnitus is called pulsatile tinnitus. Causes include 1. Atherosclerosis. With age and building up of cholesterol and other deposits, major blood vessels close to your middle and inner ear lose some of their elasticity and ability to flex or expand slightly with each heartbeat. That causes blood flow to become more forceful, making it easier for your ear to detect the beats. You can generally hear this type of tinnitus in both ears. 2. Head and neck tumors. A tumor that presses on the blood vessels in your head or neck, vascular neoplasm, can cause tinnitus and other symptoms. 3. High blood pressure. Hypertension and factors that increase blood pressure, such as stress, alcohol, and caffeine, can make tinnitus more noticeable. 4. Turbulent blood flow. Narrowing or kinking in a neck artery, carotid artery, or vein in your neck, jugular vein, can cause turbulent, irregular blood flow, leading to tinnitus. 5. Malformation of capillaries, a condition called arteriovenous malformation, AVM. Abnormal connections between arteries and veins can result in tinnitus. This type of tinnitus generally occurs in only one ear. Medications that can cause tinnitus. A number of medications may cause or worsen tinnitus. Generally, the higher the dose of the medications, the worse tinnitus becomes. Often, the unwanted noise disappears when you stop using these drugs. Medications known to cause or worsen tinnitus include antibiotics, cancer medications, water pills, quinine medications used for malaria or other health conditions. Certain antidepressants may worsen tinnitus. Aspirin, taken on commonly high doses, usually 12 or more daily. In addition, some herbal supplements can cause tinnitus, as can nicotine and caffeine. Anyone can experience tinnitus, but these factors may increase your risk. Loud noise exposure. Prolonged exposure to loud noise can damage the tiny sensory hair cells in your ear that transmit sound to your brain. People who work in noisy environments such as a factory and construction workers, musicians, and soldiers are particularly at risk. Age. As you age, the number of functioning nerve fibers in your ears declines, possibly causing hearing problems often associated with tinnitus. Gender. Men are more likely to experience tinnitus. Smoking. Smokers have a higher risk of developing tinnitus. Cardiovascular problems. Conditions that affect your blood flow, such as high blood pressure or narrow arteries, can increase your risk of tinnitus. Tinnitus can significantly affect quality of life. Although it affects people differently, if you have tinnitus, you may also experience fatigue, stress, sleep problems, memory problems, depression, anxiety, and irritability. Treating these linked conditions may not affect tinnitus directly, but it can help you feel better. In many cases, tinnitus is a result of something that can't be prevented. However, some precautions can help prevent certain kinds of tinnitus. Use hearing protection. Over time, exposure to loud noise can damage the nerves in the ears, causing hearing loss and tinnitus. If you are a musician, work in an industry that uses loud machinery, or use firearms, especially pistols or shotguns, always wear over-the-ear hearing protection. Turn down the volume. Long-term exposure to amplified music with no ear protection or listening to music at very high volume through headphones can cause hearing loss and tinnitus. Take care of your cardiovascular health. Regular exercise, eating right, and taking other steps to keep your blood vessels healthy can help prevent tinnitus linked to blood vessel disorders. If you start experiencing ringing in your ears, you should go and visit your healthcare provider. Maybe visit with your family doctor and take it up from there. You can also click the link in our description below It will take you to a website for immediate help with tinnitus. Thanks for watching and see you in the next video.